We can just get it going. Just start it.
All right.
Back again.
Episode 10, Inside and Out Med. Today, let's talk about some red flags to look for.
What about the clinic that just opened up right here, right next door? So we're at podcast studio in Boca, and another clinic.
Another wellness clinic.
it just it kind of blows my mind. When you walk into a practice or even just a business establishment, like if you go into a restaurant, you'll see their resale certificates and their licensure from DBPR in the state of Florida. And sometimes you'll walk into a medical practice. They don't have a license board. There's nothing with any certificates, anything from the DBPR, any facility licensure, no doctor's schedule. And it's like, you'd think that would be the first thing that they would put together before like just offering services, right? Staff,
And you would think that the
compliance.
state would go in and at least inspect a new
No,
medical
I told you
office.
that. I told you. Well, for dispensing, right? Because we're dealing with all that. We're currently in a shift where we're entertaining a couple different 503A versus 503B legit script certified pharmaceutical companies. Well, I guess 503A is patient specific manufacturing versus 503B is not patient specific.
Just to be clear, when you order from a 503B, you're ordering to provide the practice with medications that they subsequently dispense to individual patients
Versus-
using a dispensing license.
Yes, versus just calling. So there, I mean, you've obviously got two umbrellas. You've got a prescribing umbrella, which with an MPI DEA license you can do, and then you have dispensing, which you could fact check online. You can look up to see if your practitioner is a dispensing practitioner, and you can then operate under a different umbrella. And so we're entertaining a couple different pharmaceutical companies to see what's best for patients, what's best for the practice, what's easiest from, an A to Z standpoint, because
Well, one of the advantages of being a dispensing practice is the patient comes in and you can give them the medication at the end of that visit. If you're going to dispense the medication to them, instead of ordering it, writing a prescription, waiting for the compounding pharmacy to fill it, and then send it to the patient, they can receive the medication instantly at the end of the visit.
so you have, I get what you're saying there. So you have convenience, right? But when I look at it, right, you could have provider negligence, but you can also have patient negligence. And being able to dispense allows you to substantially micromanage their wellness plan to kind of decrease that window of any negligence. So like, here's the thing, right? You have a patient, let's say you put them on a controlled plan, right? Testosterone can't be shipped to the practice, has to be shipped to the patient. Then they bring everything in for their educational visit. A lot of patients could struggle with drawing up the medication, giving it to themselves, improper dosing, etc. I mean, don't you feel like that's a pretty big problem that is continuously occurring?
Yeah, and I think one of the
For newer
nice,
patients,
yeah,
maybe.
one of the nice things about dispensing, and I mean, if a patient comes in with their prescription, say they get a vial of tirzepatide or semaglutide, legally you can draw it up into pre-filled syringes for them and return it back to them for ease of injection, right? So they're not making any errors.
You're kind of going from prescribing to see that's where it gets weird. And obviously, we brought on that healthcare attorney, really smart guy, got in touch with all the departments to kind of solidify. If you go from prescribing to then giving pre-filled medication, does it still fall under prescribing or does it fall under dispensing? However, there's a happy medium where safer for patient, but maintaining compliance with the state, right?
Yes, and just to be clear, like when you're getting medication from a compounding pharmacy, it's going to come in a vial. So you're leaving it to the patient, even if you've educated them and gone through all the techniques, they still have to drop that dose individually each week and inject it. And there you're looking at patient. If a patient makes a mistake, instead of injecting 5 units, they inject 50 units. That's a tenfold difference in dose. And I've seen that kind of thing happen. Even though you give very clear instructions, people still make mistakes when it comes to this because they're not used to any type of thing medical, volume related, injection related. So they make very basic mistakes that can have very bad outcomes.
You know what's so funny? Anytime I give myself an injection sub-Q, for anyone not knowing sub-Q, we're
Subcutaneous,
subcutaneously. It's not in a muscle. It's in the fat,
basically
in
anywhere
your
in the fat.
stomach. I bruise myself every time,
It's weird.
every single time. But
Shouldn't.
when Jen does it for me, I've got no problems.
No, you're just
And like you think I've seen it done enough times for like if I'm taking some Moreland or something, it's multiple injections a week. I can't do it with, and I've got to rotate sides every single time because I always end up with a bruise every time I do it.
that's weird.
I mean,
You should just try a different area then.
I always do try a different area. I guess it's such a minimal problem, right? But it just goes to show you that there's so much more outlying that can occur, and dispensing starts to alleviate that because it allows you to micromanage that plan. However, they halted all dispensing facility inspections, which
Yeah, I
is
think we touched on that last time
which
because
is
there's not
crazy.
enough
So
manpower.
no one's inspecting anything. No one's coming in there to inspect the clinic that just opened up. I guess which sucks, but a complaint would have to be filed in order for the state to investigate. I'm sure they get tens of thousands of complaints that they have to filter through. They only have so many people to deal with. So it really comes down to the patient being educated on are you choosing the right practice? Are you choosing the right practitioner? Because I wouldn't go there. Would you go there?
Oh no.
I mean, like just as if there's not. There's
And
no matter how good the price was, no matter what type of marketing was put out. I mean, like, and then like next thing you should look out for, right? Is is there an AED on the wall? Like, there's a big box that should be sticking out on the wall. Ease of access for anyone to utilize. There's nothing there. No licensure. No. I mean, it's just do you think they're just like you could just open up and do it?
yeah,
Like, is that the philosophy? Like, what do you think the
everyone.
philosophy is?
Yeah, I mean everyone's doing it. It's become basically like open up a candy shop. I mean, it couldn't be.
It's probably harder than opening a med spa right now. Less the capital investment. I mean,
I
I'm kidding.
mean,
They've got to go with they've got to be under some type of board for
for food, yeah,
yeah.
yeah, it is a little ridiculous how easy it is. I mean, there's no doctors involved anymore. The owners are all like, typically like just kind of gym rats or some tatted up guy that looks like he just got out of jail, and
That's just like obsessed with every research purposes only peptide,
yeah,
right? Like everything, and like that's the biggest thing right now. And like you're scrolling through social media and everyone's like, peptides are changing my life. Peptides are changing my life. As in a properly supervised medication program where a vial is not just shipped to your house without blood work and health evaluations and in-person visits can get you on the right track for an extensive amount of time rather than getting you on the right track now with potential adverse outcomes, side effects, and everything else.
and then there's all these people. I mean, I had a patient, a very successful, well-known guy. He's a CEO of a large company, and he was asking me about retatrutide,
Retrotrutide, yeah.
and if there was a way to get it, and that he was getting it from China, some China source, and I told him like, well, this is still in phase 3 clinical trials to establish safety and efficacy, and that it would be unsafe to obtain it even from a local compounding pharmacy, let alone it would be very unsafe to obtain from an unlicensed pharmacy from outside the country. So but these are very educated, very smart people doing this, and I mean, because
How do you
there's
think
all this social
how do
media.
you think they gain so much recognition like that? A drug just, this medication
Social
just
media, man.
blew out of the water.
Yeah.
It just absolutely.
It's got to be the first drug ever to get all this attention before, while it's still in clinical trials. It's never happened before. And because it acts on 3 receptors as opposed to tirzepatide acting on 2 and
I mean,
semaglutide acting on 1.
if you realistically break it down, right, with semaglutide, tirzepatide, retatrutide, it's all just. I mean, yes, I understand your argument there, but what is it going to do? It's going to suppress your appetite, right? And if you're doing it the proper way, and you're actually utilizing the medication appropriately and doing everything externally, you're going to achieve what you want to achieve, right?
I
I mean,
think
so
there's very few
why
people.
sacrifice? Why like guess? You know, because like these are medications that are approved. I mean, like, you know, they've got to have some pretty compelling research that makes it so far superior, right? You know,
Well, that's how it's being portrayed,
but
that it's
is it
just so
factual?
much superior to even
Yeah,
tirzepatide.
but
So
is it
I don't
factual?
know.
You
I mean,
know.
it's too early to say. We don't have efficacy studies out yet.
Well,
Um,
it's like Latibo with all their efficacy studies. I remember I told you how much I hate that company.
mhm.
You know, so with our satisfaction guarantee, you come in and a neuromodulator doesn't work at 2 weeks and you're doing full correction, whatever is recommended by the provider. We need to fix it. Like, we can't just, oh, sorry, that didn't work. It's just not how, no one should operate like that. But we had to utilize other products because this vial is perfect, this vial is not perfect. This vial is perfect, this vial is not perfect. It works in patient A, it doesn't work in patient B. It
Mhm.
works in patient C, D, E, and not the rest. And we had such a problem with it, and they just wanted to keep sending vials to like say, okay, well, if you treat, you know, more clients over X amount of time, your percentage is going to be higher, but it's just not how it should be. Oh, it's a
Yeah.
bad shipment. Oh, it's this. And like, we have all these pharmaceutical fridges that are massive, that are so temperature regulated with alarm systems if they drop below. And I was like, it's just impossible. Like, this is gone. I'm not keeping this in the practice. This is a horrible product. Like, there's no, I mean, like, yeah, you've got some approvals and stuff, but there's just no way that it could be so um, inconsistent.
Yeah.
You know, it was such an inconsistent product. We got rid of it. And it's like, you don't really hear about anything that could be potentially going wrong because you don't have enough data. But it's like, once you have enough data sets, right? I mean, you don't know what the potential adverse reactions of that medication could be. You know, we had enough, and I'm not really comparing apples to apples here, but with that particular neuromodulator, that was like, all right, we got to get rid of it. You know, we can't have it anymore.
Hmm.
It's not. It should not be 5 out of 10. It should be 10 out of 10. And you know, we've had a couple patients that are like, and we send them to a company called NeuroStrive. That's where we refer them to because they do, I forget the name of it. It's very expensive
What? For what?
for Botox or Dysport, whatever you want to call it. But none of the neuromodulators work, so they have to go a step above. And
Oh,
it's,
okay.
what is it called? You got to know what it's called.
I've
If I,
never heard of this.
if yes, it's
Well, yeah, I understand that you're going to have resistance. Certain patients develop resistance to pretty much all the botulinum toxins, and then initially, um, Botox and Dysport are the first ones to reach that high level of resistance. And then sometimes you'll try Xeomin, which is supposed to have less accessory proteins and less antibody attachment sites, and that's why sometimes that's a good alternative for those patients. But you're saying that there's a step beyond that where none of them work, and then there's this other option.
hey, real quick, sorry to, yeah, it's a myoblock.
Yeah, that's a nerve block where they're not using a botulinum toxin. They're
Yes.
actually ablating the nerve that provides um, stimulation to that muscle,
Yeah,
to
so
the frontalis muscle, for example.
we've referred a couple people out to them, and they specialize in that, which is
Hmm.
pretty cool. Um, because
I've
it's
had
like,
people actually do that, and um, it worked for a little while, then it didn't.
and then it
Yeah.
stops. Why do you think that happens? Like, what do you think you get to a point where you're just so you've built up such a tolerance to it where you
It just
can't?
has to do with the antibody response, just like anything else. I mean,
Yeah.
you're dealing with a toxin. Um, Basically, that chemical is attached to acetylcholine receptor site, and it blocks stimulation at the neuromuscular junction. So eventually, your body builds up enough antibodies to fight that toxin to inactivate it.
Yeah.
So you can have patients that have some.
You don't do anything like that? You don't. Why? Do you need what do you need to be able to provide a
To do
service
that
like
procedure.
that? Yeah.
Oh, that's like more of a neurological thing. I would guess you need nerve conduction study is like equipment. You would need.
I mean, it's expensive. It's not cheap.
Yeah,
It's
it's
five,
you don't
six
want to
times
mess it up either,
the
because then you could
price.
have the patient's face looking like they had a stroke. So it's not something you want to really dabble in unless you have all the.
The proper equipment and stuff.
Mhm.
Yeah, that makes sense. And piggybacking off of, the different types of neuromodulators, it seems like there's more and more derma fillers and biostimulators coming to market, like left and right. And I've noticed a trend, specifically within our practice, that derma fillers are bad, and everyone's going, like, patients want more wellness, a more wellness approach to it, and they're going with like Sculptra Radiesse.
Mhm.
I mean, like, there's a big
I feel like
demand for it
that's
over.
ironic that they're going with Sculptra, because I know you like Sculptra. I'm not a big fan of it because one,
I've
you
never
can
done it,
you can
right?
no, but I
But
know it's worked well in a lot of places. It's been grandfathered in to a lot of people that have been doing it for a long time. But I
Sculptra's
don't
been
know
around for
that a
like
newer
15 years,
injector should.
no?
Yeah, it's been around for a long
Long
time.
time.
I don't see that it has a great advantage to any like the newer, longer lasting fillers.
Why
Like
is it blowing up now? I mean, like,
for what you said, it's like they think it's more
a
natural, but I mean, a
longevity
lot of people can
approach.
have bad reactions to that. Can have severe acne, they can have granulomatous formation, scar tissue, um, lumps, bumps, etc. You have the vigorous massage 5 times a day for 5 minutes each time
And you
for
don't
five
notice
days,
results for
and you don't notice results for 3 to 6 months.
yeah,
So
it's a substantial
it's a
amount of time.
lot of nonsense you have to go through to get there. I think Radius is a nice compromise because, I mean, it's not a very strong biostimulator,
But you
but
get the volume
you
from
get
it.
the initial volume effect from the filler component.
Mm-hmm.
Um,
Radius is
and
great.
I love it. I
You
love
could
Radius because you can do a lot of things with it. You can hyper dilute it in various
dive
concentrations.
into that a little bit, the hyperdilution part.
So Radius comes in a specific viscosity, thickness. Is typically indicated for like medium, moderate to medium sized wrinkles in the mid face. Like it's been used in the cheeks and the nasolabial folds, marionette lines.
People are using it off label pretty
But
much
it's
anywhere,
being
though.
used off label tons of places. I
Yeah.
mean, a lot of people use it in the jawline and the temples. But there's a lot of new studies to show you hyperdilute it. You could use it in the neck. Um, and hyperdiluted just means, like, say you mix it with you could use it bacteriostatic saline, or you could use a lidocaine, like 1% lidocaine, and dilute it with that 1 to 1. And in those cases, you could use it in fine lines. You could use it in even perioral lines or on the lips. You
What
would
about
not
other
want.
body indications? I mean, people are using
Yeah,
it
you
all
could
over
use
the
it in like
body.
knees,
Yeah.
saggy areas like that. But and I've also seen some studies, and I sent those to you, where it's being used in conjunction with like Softwave, where you inject the biostimulator, say in the neck, you hyperdilute it, you inject it all over the neck, and then on top of that, you couple it with
Mm-hmm.
a treatment which also increases.
So you'd inject before.
Yeah,
Yeah. And then
yeah,
do the soft wave
like a
after.
week or two before,
Yeah.
and then do like a Softwave treatment, which also stimulates collagen and elastin production.
Mm-hmm.
And so you have two mechanisms producing a collagen response.
You know what I think needs a little bit more recognition, and you've been doing it forever, which, I mean, just shows that the technology has been around for so long. It continues to adapt, gets nicer, it gets more comfortable. But lasers, I mean, just in general, resurfacing, right? Because, doing neuromodulators treatments on a quarterly basis, or if you extend it with Dax, fine, do a couple times a year, and derma fillers for a volume effect. You still want to take good care of your skin,
Hmm.
right? Because you could be You could have no movement, you could have minimal wrinkles. Uh, but we live in Florida where
There's a lot
sun
of sun damage.
it's unreal. And we'll have patients come in and they get a perfect procedure done by one of the providers, and they still have this quality of skin that's so low because of all the sun damage. And
Well, not just that, there are fine lines,
it's
texture regularities, high like pore size.
but they
That's
can't. They're like, I can't be out of the sun for 2 weeks prior to a procedure, or I can't stay out of the sun, or I can't
yeah.
I can't put a hat on. But I mean, like, if you were able to do like a decent resurfacing treatment on a quarterly basis, or even on an annual basis, if you wanted to go a little bit more ablative,
I mean, even for
you would notice
myself,
you
yeah.
would notice such a difference, right? They
It,
say, I think the general rule of thumb is like, maybe just for microneedling specifically, a treatment for every decade of life, right? So if you're 50 years old, you should go, and this is your first procedure ever performed, you should have 5 treatments back to back over 4 to 6 weeks, or as deemed necessary by
Mhm.
your provider, and then you should continue to follow up and do them as recommended,
So
right?
we're talking about resurfacing, and that applies not just to texture regularities, it's also used in scarring,
Yeah.
um, and for sun damage, pigment
Hmm.
irregularities. But there is, I think, one of the things you haven't mentioned is the way it was done a long time ago, or it's still done to this day, are chemical peels. I'm not a big fan of chemical peels because one, I think it reduces the overall integrity of the skin. Like over time, the skin does become thinner. Or if you're dealing with an older patient that has thin skin already, it can have a bad effect on
What
them.
about for like pigmentation though? Like on a darker skin type, right? When you're dealing with uneven skin tone, complexion, what's your recommendation then? Because we treat a lot of patients for that, specifically with VIPO. It's not like some substantially invasive or ridiculous like 33%. What do they go up to? I forget, like 33% TCA or something like that. It's
Yeah,
nothing
they
near
have,
that.
and
But
kojic acid,
yeah,
and
it addresses it pretty effectively. Like
it
it.
does. Yeah, but it comes back very easily too, just like
Well, what
anything.
happens when it's hormonal? We see, and that's another thing, right? You develop with like one of the most common conditions we deal with, PCOS,
Hmm.
right? Or post pregnancy, and substantial.
Normally, that, I mean, so there could be some effects of
That's a
hyperpigmentation
big
or
thing,
melasma.
post pregnancy is like a big. I'm surprised it's not
Well, now you have
addressed
this
more.
this the Toro, right? Uh,
Yes, yeah, for
that will specifically address melasma
yeah,
very
it's great
well.
for
Have you done a lot of melasma treatments with it
yeah,
yet?
we've talked about it a ton, right? So we're obviously offering tattoo removal now, fully out. All the mid levels are doing
Just to
tattoo.
be clear, though, so everyone understands, regular lasers like CO2 or fractional lasers, erbium,
They help
they're
with the
not going to
pigment.
help that much
They help
with sun
a
damage.
little.
Yeah,
We'll
but you
notice.
really need a pico
Yes.
nanosecond Q switch laser
Hmm.
to get melasma.
And the Toro has both modalities, right? Nano and Pico, and we're not advanced enough to start. Like, I couldn't put marketing dollars behind it. I don't trust us enough to do that yet.
Really?
Yeah, well,
Because that's one of the best applications of that
100%. But
machine.
I mean, you saw what we went through with the trainings, right? So it's
Yeah.
like they need to perfect and then continue, right? So the main purpose of the device was because we had such an increase in obviously tattoo removal, such a want for it. It was like dial it in, get everything going, perfect everything you're doing, then offer it to patients, and start to see all the different case studies, right? Because you have a tattooed artist over there, and over here, and they're all using different inks, all going to different depths, different colors. Is it a cover up? There's so many different
It's a very complex
variables.
process. Yeah.
So we're looking at all these different data sets to see like which they're perfecting it, fully perfecting it, and it's going well. And it's a very uncomfortable treatment to deal with, even with a topical anesthetic. And you know, I haven't developed the wing to where it's like, let's fully tack melasma yet, because we need to talk about that. Then we need to get everything going. We need to bring in people to that want to go through like the beginning phases, not patients, more like friends, family members that are like, practice, etc. Because like the company just wasn't. They had no idea. They had no clue how to. They're like looking for answers on how to train the team, and it wasn't good. Like it wasn't good. I mean, we're still going through meetings with the company, and they're a great company. I love Cartessa, but it sucked. Just flat out sucked. You saw it. You saw the recommendations. You saw what they were doing, and I was like, "You guys have no idea what you're doing."
Yeah.
And no, they don't
Calling
care.
patients to go to
Right?
the
They just want to.
hospital.
They just want to sell a device, right?
Mhm.
If a patient has an adverse reaction, they're not at liability unless I were to sue them. Which I mean, like you're not going to get anywhere doing anything like that. That you have all. I mean, like if you look at the hyperlinks correlated in their signature documents or 100-page documents embedded in these documents. Like you're not getting anywhere. So, courts may frown upon that, but it just wasn't, they don't even know the technology. It's almost as if they don't know it or their trainers don't know it or whoever trained their trainers didn't have an adequate understanding of what the device actually entailed and how much you can do with it. So we got to not revamp, but we got to initiate everything, get it under wraps, and then I'll launch it in
Well,
a
that's what I
realm
noticed
like
with
that.
like the Photona laser. I mean, the training manual on it is massive, but even all the recommendations and parameters and handpiece settings that they'll give you for treating a specific modality. I mean, you really have to fine tune that yourself because
You have to
those
fine tune
those
everything. Yes.
those recommendations are always extremely conservative because they don't want any liability. And you're not going to get great results with the typical factory presets or the factory recommendations on the training manuals. You have to become an expert through repetition.
And I think that's what most practices are doing, right? Because they just buy a laser, they utilize the laser, and they're just treating based off how the company says. And
Yeah.
it's not the right way to do
Because
it.
when you have a trainer come in, usually for one to do that, they do not use the company presets for
And
anything.
they're selling devices to, like we talked about this in so many episodes, but they're selling devices to practitioners who should not be performing those treatments. That's first. I don't know. I guess it just doesn't matter, right? I would think it would be looked at like selling alcohol to a minor. I mean, like, I don't know why they don't look at it like that, right? Because you couldn't go into a bar underage and get a drink,
Mm-hmm.
right? It's illegal. So how am I able to sell a device to someone who doesn't have the proper licensure? I mean, maybe they're getting doctors to sign off on it. I don't know, but I think that's
Yeah.
kind of blows my mind there. But yeah, no, everything should be very custom tailored to the patient, especially when you're dealing with so many different variables. Like you yourself said it, the skin is, the body's biggest organ, and how many different variables are you dealing with on a patient to patient basis with the difference in skin?
Yeah.
It's substantial. And like we both have memberships. Like the patients who have been on memberships for a couple years, like bouncing back and forth between hydrofacials and photofacials. A photofacial is very broad. You can target a bunch of different you know prevention or corrective mechanisms within it, like broken capillaries, sunspots, fine lines, whatever it may be. And the patients that are doing it on a month-to-month basis, and what I see is like during the winter time they're doing photofacials, and then during the summertime they're doing hydrofacials.
So you're still
And their skin is just, if you look at the photos in the beginning when they first started to 2-3 years later, it's exceptional.
yeah. And that should also be, I know,
What were you gonna say though? On what? You almost asked
you're
me
still doing
something.
IPL?
What do you mean? With the Candelas?
No, you said photofacial, so usually that means IPL, intense
Yeah,
pulse light.
yeah, with the Candelas.
Okay, I didn't know
Yeah.
you had like a separate machine for that.
No, it's the laser hair removal device, the Genomax Pros.
Okay, well that's Nd:YAG though. That's a neodymium laser. That's not
Yes,
IPL.
yeah, yeah. I see what you're saying. I mean, I mean, they call it a photofacial,
Oh, I
right?
see. Okay.
But
That's superior to IPL. Yeah,
yeah,
that you're doing.
it's very superior to IPL, but it's the easiest way to explain it to the patient,
Okay.
right? And obviously you could change the spot sizes, the handpieces, the settings on the device to target the specific concern, right? The device can do a lot, but it's not really it's not IPL. No, I mean, so like if someone comes in, they have broken capillaries all over their face, they're going to treat broken capillaries,
Yeah.
right? Someone comes in, they have sunspots, they're going to treat sunspots.
Yeah, that's what that particular wavelength's good for. It's
Yes.
good for vascular lesions,
Vascularly, it's incredible
superficial hyperpigmented lesions,
Yeah.
and obviously hair removal. It's
It's
also
the
good.
most
It's also
effective
can
for
have
it.
some effect in tightening the skin as well.
Because of the
and heat.
A lot of patients notice that, but you need to be consistently doing it. And if anything is hormonal, like you're committed to it. Like you should be committed to it indefinitely. Like
One thing I want to talk to you about is that I think gets ignored a lot because a lot of dermatologists are doing all of these like 5FU treatments or
what is that?
Well, they're putting on 5-fluorouracil, which is a chemical basically burns the skin, and it's to use to treat actinic keratosis, which is like a precancerous lesion. And a lot of people have like a lot of these AK lesions on them. It's like basically sometimes you'll have a scab or something.
How does
And
it
it's rough
develop?
area. And it looks and it just doesn't heal. They keep picking at it, and it just doesn't heal. It could bleed, and then get a scab on it, and then it just never heals. That's usually it. Usually kind of has a pearly like texture
How does it develop? Just over
from
time?
from sun,
Okay.
usually sun damage, and I'm telling you, like these people are going through these horrible treatments with 5FU, which basically burn. They put it all over their face, or they put it all over part of their face, and like it's intense. It burns the skin. It's like, but with the erbium, or even use a CO2 laser, take these lesions off really easily with almost no downtime, and it works really, really well. Another thing that works well for those is chemical peels. I don't know if they ever told you about that with the chemical peels, but
I mean, it's a good company. I like them, but all these companies, the reps come in and out. We have very few reps or trainers who have stayed with the company since we've been in business, right? And you experience that too. How many of your reps are the same since the very beginning? I just wish the companies marketed it like this medication retatrutide is being marketed, right? Because and I don't know if it's because of it might be a liability for the company, but I mean, a lot of these devices, when operated with properly, can create significant improvement without having to go through like exactly what you're talking about with these derms or with other practitioners. I mean, when you take laser hair removal, right? Very, very usually it should be very simple. It's not. Right, we have practices call all the time when a patient doesn't like to, continue their plan because of the fees. Like the practices call to obtain the medical records for the settings because they don't know what settings to put the patient at. And this laser hair removal device compared to this laser hair removal device is very different, right? You have gold standards in the category of laser hair removal in terms of equipment. And then you have another gold standard on top of that, which is the practitioner operating that device, right? So I just wish patients saw it like that, So like we obviously all have our introductory offers, but, to have a qualified operator of a piece of equipment, that's when you get a good outcome. When the equipment is good and the provider is good, then you get the good outcome. But you have all these little, and it makes it, we talk about it all day about how mad it makes us, but you got all these holes in the wall that are buying all this shit, excuse my language, from China, right? That have, very little indication to be doing what they're doing. And now they offer laser hair removal, and that's why you have a med spa in every single corner. Or that's why people are diving into, how can we treat this condition with a cheaper or more cost-effective approach to it. And then they market it like that. It becomes successful because it's affordable, and you have a couple good case studies, post a couple before and afters, edit this, edit that, and then voila, now you have a med spa. And like that's like the rule of thumb now. I mean, that's the way it's going. I just wish, I mean, like, I can see the curve, it's good to be on the hopefully, like, we're doing everything we can to be on the right side of that curve, but I can see it. We would be able to look up med spa near me, walk into all these places and point out 101 different red flags,
Yeah.
like, without even batting an eye. And it's just because I don't even know why. I honestly have no idea why. I don't know why. I don't know why anyone would want to operate like that. Maybe they think it's the proper way. You should want a result. Like, you shouldn't want a treatment. You should want a result. You should be looking to gain something, whether it's prevention or correction, or health, within health, wellness, weight loss, weight gain, cognitive function, increased libido, increased drive. You should be wanting a result for whatever treatment or procedure you're seeking. And if everyone looked at it like that, like, this is what I want to obtain, that I think that's why we can offer a satisfaction guarantee.
Yeah.
Because, like, we're not going to recommend something that's not going to give you what you want.
I think that's a really admirable thing that you do, because a lot of places won't give them any kind of satisfaction guarantee. And I think part of that is, well, some people may abuse that to try to get free procedures.
Some people do abuse that, don't get me wrong, but I mean, like, so why am I in business, right? Or why are you in business?
But the way you approach that then is you're going to say, well, if you're
People
not
will
happy,
always
we'll
abuse.
fix it. We're not going to refund it because you just
but
subjectively
in some
say
cases, though, and, like, we
Yeah.
obviously have documents and everything that protects the company, like any business owner would do. And, at some point, though,
yes, you have to make exceptions.
I listen to what it comes down to is I don't perform treatments, right? You have to trust the people in your operation. So I go to and I'm like, talk to me, like, what's going on? They're like, this patient's difficult. I can't get her happy. And I think if we continue to treat, she will still be unhappy, or he will still be unhappy,
There are
right?
patients like that.
And
you can never make them happy.
And, they're like, I can try everything we can, but I don't think they're going to be happy. And I'm like, well, you're telling me that now you don't want to perform a medical procedure. We can't physically allow you to perform this medical procedure. In my opinion, it'd be best to just refund their money.
In those cases, yes.
And that patient, I'd like to think, knows deep down inside that, listen, they would have tried everything. Maybe I'm just being difficult. Maybe I should understand that I need to go through a lot more of an extensive plan than just a syringe of filler to fix my full face.
It's not even that.
And that's the way,
I think
right?
there are just some people that have, psychiatric issues, and they either have extremely distorted expectations, or they can't see what they looked like before, even if you show them a picture and show them, how much it improved. I've had patients come back. They've had their Botox looks absolutely perfect, beyond perfect. They've had deep lines in their head, or the forehead or the glabella area that Botox won't resolve because it only relaxes the muscle. It's not going to get rid of very deep creases. It'll make them look better. And I have to explain to them, like, listen, this isn't going to go away overnight. You let it get to the point where you have extremely deep creases. We could treat those with filler, or you could keep doing Botox. Over time, it'll get a little bit better. But and they somehow think that Botox is a magical cure, will totally resolve every single wrinkle they have on their face. And even when you explain all these things to some patients, everything can be done perfectly.
Yes, but
and they're extremely unhappy.
This is when I side with a patient, right? And this is what I do. No one wants to get older, right? That's why we're doing what we're doing, right? Because everyone wants to combat age. So and this is the way I was able to prevent abuse, in a sense, of the policy, is all the providers chart, right? And I'm like, if they don't go with your recommendations, you need to acknowledge that and put it in writing that the patient decided not to go with your recommendations due to maybe, 99% of the time it's budget.
Financial, right?
It's financial.
Yeah.
99% of the time it's financial. But you need to acknowledge that in your medical treatment note, and they do. And, very rarely do I have to get involved in an administrative standpoint, right? That's when none of the levels the providers can't handle it. Patient success coordinators can't handle it. Branch managers, office managers, they still can't handle it. Then, I'll sit down. I'll be like, what's wrong, right? And they start to express and they start to, show all these different things. And I'm like, I know, like, it's why you're here. You're here because you want to combat age. But I'm looking at a note. Why didn't you go with their recommendations?
Mm.
I'm like, if you went with their recommendations, we'd be in a completely different situation right now. And I'd be like talking to the provider instead of me being with the patient, be me with the provider and be like, well, the patient went with your recommendations. Like, we got to figure it out. And it resolved 99% of the conversations, right? Because the patient was like, yeah, I mean, like, how am I gonna fight what he's saying right now? I didn't go with the provider. I'm like, I'm looking, I could show you the note, you know, and then it's like hearsay, right? Oh, I went with it. I went some, then you have the 1% that's like, I went with her recommendations. What are you talking about, right? And that's when it turns into hearsay.
Yeah.
And then it's just customer service. Okay, I'm sorry. This is what we can do. But it resolved a lot of it, a lot of the abuse with the policy. I don't, knock on wood, I don't really have to deal with a lot of it. The patients are happy, the providers are happy because they're making patients happy. But there will, like you were saying, there's always going to be abuse of policies. People are always going to try and abuse policies.
Mm-hmm.
But I guess that's the
I mean,
problems, right?
most patients are very reasonable and they're nice and even if they are unhappy for whatever reason, if you sit down, take the time to explain to them what happened, why they're maybe perceiving something that isn't that bad in such a negative way, if you take the time to look at the before picture, look at their after pictures, most of the time you can take a very unhappy patient and they'll walk out very satisfied. It's just a matter of taking the time to communicate with them, listening to their concerns, and doing maybe little thing to touch up whatever they're unhappy about. If you can touch it up, and that makes a huge difference.
For practitioners out there, $100 or $200, even $300 in product is not going to make or break your business.
Yeah.
It's not. So, like, if you willingly know that it could have been better, let's not fix it, because I promise that $100, whatever it may be, is not nearly as negative as an unhappy patient. If you have an, I don't want anyone to ever have a bad taste of Refresh in their mouth, right? Because it's like, I went to this practice and I hated it and everything sucked. It's like, that's the last thing I would want people to reflect on after their visit with Refresh, or like with your clinic or with any clinic. So it's like, just at the end of the day, do everything you can to make the patient happy. If you can't, I mean, there are those uncommon variables of being in business, right? Or being in medicine or in any realm. We're just, in this realm, it's dealing with patients. And that helped a lot too, right? I mean, like, it obviously, you try your best to make everything perfect. And when it's not, it also hurts the provider a little bit, right? Because it's like, what could I have done better? What happened?
Yeah.
Like, why was that the reaction that occurred?
Yeah, you can think you did an amazing job. The person had a wonderful outcome, and
Still
you could
unhappy.
literally have the most unhappy patient that ever existed. And it's a very
Difficult feeling.
it's a strange dynamic to live in and practice in. But you're going to deal with patients like that every once in a while, like maybe one or two a year, which it doesn't make any sense, and you just gotta go through it. And because it is just like anything else, we can't make everybody happy, no matter what you do.
Of course, but I mean, if the top clinics that survive and that do operate like this, that's where I think you'll see a shift, right? Versus all these little. Yeah, I don't understand how people are how like IV therapy is the sole business model. On another note, real quick, I don't know why.
Well, that's why it all branched out into medical spas.
Like, I mean, it's
It's such a
started
bad
with
business by itself.
IV infusions or IM injections everywhere, and now it's like, oh, we also offer Botox, and then it's like, all right, I get a piece of equipment, and it's just like keeps continuing to be like this
Yeah, there's not a
evolving door.
single IV therapy practice that didn't branch out to start doing injectables and weight loss. I mean, they all do it,
Well, but here's the thing, and
and
I,
that's
I started to see it a little bit, but not as much as I would like to see it. We try and make plans affordable, but as affordable as possible, right? But there's a significant cost to everything we do, and we had some patients that stopped plans with us because, like, I mean, you can go online and buy they're selling it by the milligram, which should be a red flag to begin with, right?
yeah,
You shouldn't choose your own milligram.
yeah. You're
It's
not
just
dosing yourself, which is
That's not
strange. But
very bad.
I
But
mean, I
that
could see if they're been getting consistently the same dose for many years, and then they're like, "Well, I found
I'm
it
always on
online,"
this.
and
Yeah, but it shouldn't be allowed to be sold like that, right?
no,
Like the provider dictates the plan, dictates the price. But so like you go on there, you buy whatever, and we had a couple patients, and I heard about it through the providers that they started to do that, and they got sick or that they couldn't combat the symptoms and like who's gonna when you have no bowel movement and you're nauseous and you want to throw up after everything you eat,
hmm
who do you call? You fill out a ticket online and
yeah, they're gonna have to call some chat bot on the
hope
website.
someone assists. And they came back.
hmm
And they came back because being on a medication or being on a program or starting something, you're going to want to continue these effects. You want to do it the right way and do it long term, right? Or when you need to come off, wean off, or do everything so it supports the body and doesn't do the opposite. And we had patients that which is understandable, found a more cost-effective approach, and it counteracted, and they came back. And that type of stuff, it sucks to see them go through that. But in a sense, I was like, I appreciate you trusting us, like
Yeah.
for coming back and seeing that this is the way things are supposed to be.
Or the not just those things, but or the whatever compound they get online shipped to their house does not work nearly as well as what you've given them.
Yeah,
And
it's
and,
the
and us
efficacy of
personally,
it.
we've gone through multiple pharmacies and we've noticed changes in efficacy between two different pharmacies offering the exact same compound. So we've already done the legwork there.
Well,
you
because
know?
here's the thing: is as practices cut corners, pharmacies are going to do the same thing, right? So you have to go through, you have to vet. You really, it's like a vetting process,
Yeah.
right? I mean, we've been through a lot. Like we've seen, and I love hearing when a patient's like, for some reason, like they'll come in off of an extreme, like we will have it where a patient will come in on an extremely, like a higher dose, not extremely high, but like a higher dose. And the providers are, I don't want to start you there. I want to start you here. I'm just not going to put you all the way up there right off the bat.
Mhm.
And
Yeah, and then you find out
and they're-
even that dose,
and they're like,
which is way less than what they've taken.
it's crazy.
Yeah.
And it comes down to the efficacy of the compound, and they're just like, I don't know why, but like and sometimes we'll even take them further down, right? And the patients are blown away, and I'm like, listen, this is the way it's supposed to be done.
You got to be careful when someone comes in from another clinic or from an online weight loss place and they say, "Oh, I've been taking this dose. I've been tolerating this dose. I do fine with this dose." And the dose seems like, In those patients, you can't just trust them on the. I mean, you need to take a conservative approach because if you did dose them the way they were saying they've historically been dosed, you could cause a major problem. Like they could be,
You could be
you know, you could
hospitalized
be
over it,
throwing
yeah.
up for 2 or 3 days,
Mm-hmm.
and that's not something you want to take a chance with. So you have to be very careful in that case.
And it is, it somewhat brings a smile to my face when these patients they come back and they appreciate the program and like everything it entails.
But
Because some
we're not just the thing is it's not just that they have direct contact with the provider and the provider spends some time with them every month. We're weighing them. We're
But yeah,
doing
the
a detailed
compositions,
body
vitals,
composition test. We're
medical history.
checking their vitals. And in some cases, we'll be following up on blood work or doing an initial blood panel.
Mm-hmm.
So there's a lot more to it than there's a lot more personalization,
I
customization.
want a patient to to fill out our intake packet and then fill out one of the medical questionnaires online.
Yeah.
And you know why I think it's like that though? I
But
think
honestly, no one even looks at the questionnaires online.
that's what's like it's like a software that automatically approves or
Yes.
says what. But here, because they don't have someone who could read and understand what the answers of questions are permitting out, right? So like you have a bunch of different variables, all these different patients. It could be on all different types of medications, have different hospitalizations, surgeries, whatever it may be. They put all these different answers down for all your medical intake, and you need to have someone who can understand everything that they're doing, right?
Hmm.
That's why I think these companies, they wouldn't know. It's a liability in a sense, right? Because if they don't know that could be a contraindication to putting them on this program, that then if they need someone to understand that. You know, and I think that's a huge thing, right? Like just strictly compare apples to apples intakes, right? And then compare the next thing. Like I guess patients can look at it as like an inconvenience. Oh, I don't want to go in there. I don't want to do all this. But like it's an investment in yourself and in your health, right? If you're already making you obviously want to take the first step, take the step down the right path and not the wrong path, right? You know, some people might be successful on that path and using ChatGPT and trying to figure it out on their own or any other type of AI integration that's going to pull from a bunch of different various sources. But like, just go to a medical professional, go be seen in person, and do it the right way.
Now there's all this stuff. I know we're kind of ventured off into talking about GLP-1s, but now they're like talking about microdosing again. This was something that was initially introduced when these GLP-1s
Is
came
that even
out.
a thing?
It's just dividing the dose up, like daily injections, and I don't think it's effective. But now they're acting like, oh, now Roe is offering microdosing. Roe is offering a special GLP-1 that activates two receptors. Well, that's tirzepatide, that's Mounjaro. That's always been the case, but now it's just the way they
It's just the way
present
they're
it.
saying it.
Yeah, and
Yeah.
it's just
You know what's
like,
crazy though is like, do you think a doctor is developing these protocols? Like you've developed substantial protocols for us, like for everything, right? I mean, like you've been practicing medicine for so long. You've seen so many different case studies. This is the way the protocol needs to be followed, right?
hmm.
Like, who do you think's developing? Do you think it's just a pharmacist? It's like, oh, this is the way we're gonna do it. You think it's a doc? Like, is it a one size fits all approach? Like, I mean, you know, you have a you have a patient come in, right? You have no idea what dose you're gonna put them on, regardless of what information they put on their intake and what other clinics they've been to, right? You need to put
Hmm.
them through all the body comps and everything you do.
Hmm.
I mean, like you could fill out a questionnaire and you've got a prescribed dose. So either we're doing something wrong and inefficient, or like like, I mean, like a
I
meat,
mean, because
right?
they basically just use a one size fits all approach, those online places. They
It's
start everyone off the
crazy.
same way. And
It's like it's
yeah.
instantaneous, right? Like
Hmm.
it's like, I mean, like how many they've got to be popping out prescriptions faster than the way I'm snapping
Oh,
right now,
yeah.
right?
Imagine those big sites are probably doing 1,000 new prescriptions a day.
How do
Like
you,
Roe or Hims and Hers, or you know, yeah, they're
but it's like the state, or like, I mean at that point it'd probably be federal, right? Because you're serving so many different states. Um, I mean, they've got so much money. How do
it's
you
still
fight
going to be
them?
state by state.
You can't fight them, right? I mean, yeah, I know it's state by state, but then who goes after a company like that? Each individual state based off of
You'd
them.
have to, yeah.
I mean, like, why isn't so when everything happened with the opioid pandemic, and I know we talk about this a lot, but it's like the big bulk of what's going on in our industry right now, and like why people need to be on the right side of it, providers and patients. What happened? Like, what was it came down to a federal crackdown, no?
Hmm.
It was federally dealt with.
But it was still controlled individually by the states, like the different.
So were there different charges in different states and different repercussions in different states?
Yeah.
You think that's how
Yeah,
that's
some states were strictly enforced certain things, others didn't. Like, I mean, Florida was a little bit more lenient with a lot of things.
mm-hmm.
Um, as far as mask mandates and vaccine mandates, and um, you know,
Oh yeah, that's a good perspective, right? Yeah, it does.
um, and even when I, when they had COVID, it was one of the first clinics to start offering antibody testing, and I was providing that to the
Were you
patients.
doing that a lot?
A decent amount, like not like super high volume, maybe like 10 patients a week or something.
Okay.
And more so when it first came out, after a while that was like commonplace with all these kits
You
and
know what's
stuff you can get.
crazy though is like you go to a clinic, sometimes you don't even see a doctor, right? Or you don't see a mid-level
Hmm.
who works directly with a doctor or something. Or and like you go to a place like yours. I mean, you're hands-on, like you and Crystal, right? You're seeing
Hmm.
the same two faces every time. I mean, you think patients would highly appreciate that, right?
Yeah, I think a
You
lot do, but at the same time there's people that just want the bare minimum, the lowest price, the highest volume type place, no personalization, no
It has to be personalized.
concierge. Yeah.
It doesn't work if it's not. I mean, like even like people make it seem like injecting Botox is or doing anything is so easy. Like, I mean, so many things could happen or go wrong or be improper. Like, I mean, I don't know. I guess it's just because we're in the industry, but
I mean, it's still to this day get patients, pulling up websites and finding. I'm like, I can't match that price. I'm sorry. I mean, what you're getting here far superior treatment than what you're
there's so much
comparing this to.
value behind it,
Yeah,
right?
and
I mean,
and
like,
and they're like, okay. I mean, I'm like, go try it. I mean, go. I mean, I can't talk. I know money is a big issue for some patients, and
but then
and
we've got payment plans in house. Like, we do everything in our power to make it affordable. But again, wellness and aesthetics is a luxury item. But in my opinion, it's a very important luxury item because I mean, people say it, I've been saying it for decades. You feel good, you look good, you feel good, you play good in a sense, right? If you feel so bad about yourself all the time, you're not going to perform well. So, I
oh
mean,
no, it definitely manifests in personal success.
huge, right?
Yes.
Like if you feel great on the inside, if you feel great on the outside, if you look great on the outside, if you're taking care of yourself, there's significant mental reward with that. And that,
And career rewards in your career, people perform much better. There's lots of studies to show that
mm-hmm.
that they'll be much more financially successful. If their health is being addressed at the best possible way, like if their hormones are optimized, if they're feeling more energy, their cognitive um, focus is much higher, they will perform much better in their jobs, and the amount that it costs them to get there is pennies on the dollar compared to how much they'll
Reap
compensate
and benefit.
financially.
Yeah.
Yes,
Well, you could also probably ditch a couple bad habits. I mean, everyone's
that's
got
true.
bad habits,
Yeah,
right? Like, so if like, like, yeah, sure, forecast. Like, I mean, invest in yourself, but ditch a couple bad habits. It'll cover the cost of it. I'm almost certain. But this was our first podcast of 2026. That's crazy.
yeah.
Yeah. So I mean,
Wow,
happy New Year to everyone out there. I guess we'll see you next week.
sounds good.
It's crazy how it just flows now. Remember our first fucking episode, dude?